I'd like to introduce you to my grandparents. In their early 50s, they both developed high blood pressure and high cholesterol. But my grandfather had the added complication of being diabetic. In his late 70s, he had a massive heart attack, which took his life within the hour. Several years later, my grandmother suffered a stroke, and a very difficult decision was made to take her off life support. Recently, my mom was diagnosed with high blood pressure, and I fear, based upon our genetic history, may suffer the same fate as her parents. What does this mean for me and my children? Every 7 minutes in Canada, someone dies from heart disease or stroke. High blood pressure and high cholesterol are two of the key risk factors that, if left untreated, may lead to a heart attack or stroke. The annual cost? $21 billion. Current treatments include multiple medications and a variety of lifestyle changes. Yet despite this, nearly 2 out of every 3 adults in the US with high cholesterol and about half with high blood pressure still cannot attain safe, healthy levels. But what if we could target and lower blood pressure and cholesterol levels simultaneously using a single treatment plan? And what if this treatment were a food? Well, flaxseed, which is widely produced in Canada and available at your local grocery store, may be exactly the food we want. A clinical trial involving 110 patients with heart disease was designed to assess the blood pressure and cholesterol-lowering effects of eating flaxseed. Patients were randomized into one of 2 treatment groups. One group was asked to eat foods containing 3 tablespoons per day of ground flaxseed, and the other whole wheat. What we found after 6 months was the group that was eating flaxseed had the largest reduction in blood pressure that has ever been observed using a nutritional product. We also saw a significant decrease in cholesterol. So what does this mean to you and me? A drop in blood pressure to the extent that we observed would mean a 30% reduction in heart attacks and a 40% reduction in strokes. The drop in cholesterol would mean a 20% decrease in heart disease. If eating flaxseed can lead to less heart attacks, less strokes, and maybe even less medications, this may be an inexpensive solution to a multi-billion-dollar problem. As you can see, dietary flaxseed may be the next superfood that can easily be added to your diet to effectively lower 2, not just 1, but 2 of the most important risk factors of heart disease and stroke. Imagine ground flaxseed as the new prescription given to your loved ones to ease their burden of heart disease. Thank you.